Hi, I'm Dr. Ann Magner, and I graduated from New York University Dental College in 1980. So I've been in practice now for just about 30 years, and time has flown. And I've seen a lot of changes during that time. Changes really for the better.
I chose dentistry. Um, I was originally headed towards medical school. However, I like to work with my hands, and I saw that dentistry is a hands-on profession, and it's fun. It's challenging. It's always something new. You form a better relationship with your patients, and for those reasons I went ahead with dentistry.
I like to take out teeth. I like to see blood. No, no, no. Actually, it's true. I like surgery. But you see, that's why I cannot say why I like. I like because I like surgery. I like do surgeries. I was thinking about a reason why I went to dental school, and I really don't remember anymore. But I love what I do, and I just basically talking to people, explaining to them, helping them. It just make it to me.
I love helping people. I love dealing with the public. I'm a people person. For my for my preference, I also want to be able to do things with my hands. I happen to be very dexterous. I used to play a violin, and it affords me the ability to be more creative and more artistic in my working with patients.
Hello, my name is Dr. Amy Rojas. I graduated from the University of Medicine and Dentistry of New Jersey in Newark, New Jersey. I'm a general dentist. I see approximately anywhere from 40 to 50 patients a week. How would my patients describe me? I would probably say as caring, very talkative, like to discuss everything with them, so they're very, very comfortable. And at the same time, very polite. I like to listen to them and see what they need, their special needs.
What do you do when a patient comes to you and he's scared of a dentist?
What do I do? Shut up, open your mouth.
Not taking care of myself, depression, bulimia, I guess, I don't know, a lot of bad stuff in my life, I think. And now I'm finally out of it, and I need to take care of myself.
I didn't have perfectly straight teeth, but I did not have a gap. Like I had a little gap in between my front teeth. I didn't have that. But then when I got my wisdom teeth taken out, right after that, over the years, my teeth spread. So I want that closed up and want perfect teeth now.
I had some shipyard dental work when I was in the military. Very bad work, and they used caulk for fillings, and of course that deteriorated, and I lost some teeth, and over the years my whole jaw structure shifted, causing me to lose my front teeth.
Went to one dentist, and he left me sitting in a chair while he went to the post office. I walked out and never went back again. Then I went to another dentist, and he wouldn't listen to me. You know, he just like, I don't know, I just didn't like the dentist.
Very rough. She was doing it very hard and rough, so it was a lot of pain, and I just hated going over there. And I guess I felt too ashamed when I was a child that I used to have, like, I would say cavities. And she was not like good about it. She used to scream at me, make me feel even worse.
Shut up, open your mouth.
So I never liked going over there at all. And then I had to listen to my father too afterwards, and it was just a very bad experience.
I mean, I know people who have gone and who have like gotten really bad infections because, you know, the dentist didn't follow up or didn't give them antibiotics after like a serious oral surgery. I know people who have lost teeth because of it and had to then get implants or didn't go back. And then like, I know people who have like serious dental problems who just don't go.
I've met people that have a lot of money also and their teeth look horrible. and I don't understand why. I mean, I work in corporate America, and there's managers, VPs making hundreds of thousands of dollars that are Caucasian, and their teeth look horrible. So I think it's kind of a personal choice too. But the younger generation, my generation, I'm in my 20s, I think for us, we're kind of into um, kind of like cosmetic type of things and trying to look good and have this perception. And I think people that don't have money definitely want to have their teeth look good. And the people that have the money get it done. They get their teeth fixed immediately.
I believe with experience and talking to patients, usually it has to do with an experience that they had at a particular time in their life, usually childhood, and that stays with them throughout their lifetime. Dental phobia can be easily overcome by going about treatment slowly, explaining to the patient what is going to happen, maybe allowing them to see it in the mirror so they can see the work being done, makes the patient a lot more comfortable.
The procedure I think most patients all across the board are scared of is the local anesthesia. That's giving them the needle, of course, where they refer to as. And I think it's just because of that initial start of the procedure where they feel that small pinch and they're very apprehensive, I think, about that. After once that phase goes by, the patient's mostly always very comfortable.
As soon as they see a needle, then it doesn't matter if you use it or not, then it's just everything change.
And willing to sit in the chair and have treatment done with no problems.
They become very anxious. Don't let you, do the poor job.
I get very, very scared. I cry, I scream, my mother has to come with me and hold my hand while the dentist do anything with me because I get very, very scared.
Start doing the easy work first. Sometimes they start with simple stuff that sometimes we don't have to use any needles. And eventually, while they get used to you, knowing you, trust you, then you can start adding some more stuff, more complex stuff.
Sometimes it did hurt, so I had to put like several. I think at one point I had even 4 one time. And I still just felt uncomfort. I don't know. Having your mouth that wide open, always bursting in the sides, and like working in my mouth. It's in the head, so it's not comfortable at all.
So I'm going to give you some anesthesia first, okay? And open your mouth. And just relax, okay? Just relax. Close a little bit, close a little bit, close a little bit. That's it. And that's it. Okay? Now, we get it to the lower.
You did a good job.
It wasn't too bad, right?
You did a good job. Usually they're like, I don't know, like in there, like and it hurts, and like open up. Not bad. It's the best one so far that I ever had.
When I was younger, I was in a gym class and I had an accident where a kid like head-butted me and it pushed my front tooth all the way back. And the dentist I went to at the time wasn't very good, and he just pushed it back in place and never followed up again with me about it. Just did, regular cleanings and stuff. And then come to find out a few years later, my root died and I had to have a root canal on that tooth. And then they went back in and did a root canal and a filling, and they had to like laser the back of my gum in order to do the filling. And then the tooth got darker and darker, and they actually had to remove the tooth.
The military is a free service, so of course they're not going to take the kind of care that a top-notch professional in, say, in New York would.
I was in the Army, my wisdom teeth were coming in crooked, and they pulled 2 of them top with no Novocaine. They just pulled them out, and you had to take it, and that was it.
This was in the military?
Yeah.
Like about what year was that?
1956.
Well, I wouldn't say that that's really a justifiable or an excuse, because they have the knowledge today that there is anesthesia, and these people are in their 40s and their 50s, and their teeth look absolutely horrible. I mean, my direct all right, now I don't want to get too far into it, but I know somebody and their teeth are really, really yellow, and they make $100,000 a year or more. It's like unacceptable. I don't even want to be in a meeting with her, and it's like not pleasant to look at. And it's a lot of people, so I don't know. Maybe it's laziness. Maybe it's, I don't know. They rather spend their money on something else. I don't know what it is. I don't know.
They pulled the wisdom tooth. They had taken a little bit of the jawbone, so I could not get any teeth. There was not enough jawbone, so they had to use my blood and with this other stuff. I don't know the names of it. And they put it in with a hammer and chisel, a little tiny hammer and chisel, and it was painful. Nothing you can't live with, but it was painful. But now I got teeth back there. I have a jawbone back there that works.
Well, obviously, your mouth, it tells, like, you can have a patient walk into the office and they're like, oh yeah, I floss my teeth every day, I brush my teeth every day, and then the doctor goes in there, does the exam, and then like you see that like his gums are like bleeding or like scarred because he probably flossed the night before, and that's about it. So it's all evident in what you see in the patient's mouth. I'm not saying you can categorize patients based on the anatomy of their teeth, because it is a case-to-case basis. Every patient is different. Like how I was raised, what I eat is different from probably what you eat. And so, I mean, I wouldn't really, we don't, at least in my practice, in my history in the dental field, I don't like to classify anybody, because I used to work in Mansfield, Texas. That's out in the country. You have older gentlemen walk in, you know, in overalls, like all from the farm field. And then, like, you know, they say, oh, I don't have insurance, I don't have this, I need a full set of denture, or whatever the situation is. And then all of a sudden, they come up with this, like, this wad of cash. So you can't really generalize anybody. I can walk off the street with my, like, Louis Vuitton or something and then not have a dime to my name. So we don't classify anybody. We like to treat everybody equally. Obviously, like their choice, everybody has treatment options when it comes to dentistry. Like if you can afford a laser gum treatment as opposed to the traditional conventional type of treatment, then obviously, you know, you have that option, and we like to give those options to all of our patients because of the new technology. Like you can do laser fillings nowadays, you can do flexible dentures, but obviously we offer that to everybody, but not everybody can afford it. And
It does affect your hygiene, only because if you don't have insurance, you're not going to go and pay the hundreds of dollars just to get cleanings regularly. But there are people who have money and have great insurance who just don't go to the dentist because they're afraid. So it can go either way. But people who have more money are usually in larger social circles, so they're going to be more conscious of their teeth.
Digital radiography. It's great because, number one, we get our picture very quickly. We know right away whether or not we've gotten an accurate x-ray. It reduces the load of radiation to the patient so that we can take x-rays really whenever we need them without worrying about exposing the patient to excess radiation. And today, it really allows us to manipulate the x-ray, to take measurements from the x-ray. Just really enables us to see more than we can from our typical radiographic film. We've also come into the age of having dental scans or x-ray machines that can give us three-dimensional x-rays, and they have been brought down to a size that we can utilize in our dental operatories. Previously, a patient would have to go to a radiology center or a hospital in order to have these x-rays taken, and the reality is that they were exposed to more radiation than was really needed from our dental scans. Our dental scans focus primarily on the area of interest for us, which is from the lower jaw to really just below the eyes. But it allows us to see the sinuses. It allows us to reconstruct the jaw in a three-dimensional manner so that we can get an idea of the volume of bone that is present in the jaws. This is particularly important when we're dealing with dental implants, but it can also give us additional information when if patients have certain anomalies, if we're looking for cysts. It shows us if there are problems in the sinuses. So the X-rays have been a great improvement in dentistry in these 30 years since I've been in dentistry.
The dentist yesterday.
Oh, here we go.
And every time you go to the dentist, they tell you one thing and then something else happens. You know what I'm saying?
What happened this
time? Well, originally I was, I don't know, eating, you know, I love peanut brittle. And I busted off a hunk of something.
You did?
Yeah, so I went to the dentist and he says, oh yeah, this is a thing. He says, I'm going to knock it out completely. So he knocks it out completely yesterday, and it's one of those deals where I get about a quart of Novocaine.
Yeah.
I'm just now getting the feeling back in my elbows.
Right, yes.
And so he puts on a temporary. He says this will be a two-part deal. He said I have to put on a temporary thing. So they put all of that goo in your mouth. And you bite,
right down.
and then the goo hardens, and then they pry your mouth open, and then they got a thing, and they put a temporary in there. And he says, you come back in 2 weeks, I'll put in the permanent. And I said, oh, well, gee, I don't know. How do I know? Well, he said, no, 2 weeks will be just fine, and we'll see you then. So then I have to leave, and then today, not even 24 hours later, the damn thing comes out.
Ever it comes out?
Yeah.
Oh.
So I have like a hole in the side of my mouth the size of an above-ground pool. And every now and then I can't help putting my tongue in.
Of course, your tongue goes right there. Oh.
And I'm just now waiting for the nerve pain to return.
Of course.
It's that electric. Oh. You know, it's sensitive to heat. It's sensitive to cold. And hey, I'm supposed to wait 2 weeks.
Oh.
We are able to do things more quickly. We can have equipment and machinery in our offices or a nearby laboratory where crowns and onlays and other restorations can be done within a very short period of time, sometimes as little as an hour.
After the dentist is done preparing the tooth, they would then image the preparation onto the computer monitor by the use of an intraoral camera. Once the image of the tooth is on the computer monitor, they would then be able to design the different parameters of the filling, how tall it is, how wide it is, how thick it would be, the shape of the restoration on the computer through the software program. Once the dentist has defined the outer parameters of that restoration, then the machine would mill that restoration in 3 dimensions out of the ceramic block material. And what's nice about the CAD/CAM technique is it allows us to use the porcelain in a more conservative nature at the chair, similar to what you would do with a composite resin. So it gives the patient another alternative for a very nice-looking, long-lasting restoration.
We did the bone graft, which was extremely painful, and then before I started the process for the implant, I decided to get the braces so that my teeth will be straight once the implant is in.
My teeth were all gone; they were rotted away from smoking. You know, I never drank, but I smoked a lot, heavy. And once I got started, it was long, it was painful, but the rewards are out of this world.
Take care of your teeth. I always tell, like, to kids that I see, to my husband's son, I always tell him, don't eat too much candy, look at these teeth. You don't want to have teeth like this, so take care of your teeth. It's best to have your own, but now I'm not fortunate to have my own, so I have to do something about it.
It was well worth it in the long run.